Hi, I'm Dr. Mike Milligan. We're here at the American Academy for Oral Systemic Health meeting at the Cleveland Clinic in Cleveland, Ohio. So there's a little background noise. I'm here at one of the booths that's very important for you to learn about, and it's the Spry booth, Xylitol booth, and I'm here with Lisa Stillman. Lisa, thanks so much for being with us.
Well, thank you so much for being here and interviewing us. This is great.
You bet. Well, we all need to learn more about Xylitol. So tell us a little bit about Xylitol and Spry and your company here.
Well, Xylitol actually has been around for a very long time, over 100 years, but in the United States it's really not talked about very much. They found out that Xylitol has very wonderful dental benefits, and it was kind of accidentally. It was back during the World War II in Finland, and they were utilizing Xylitol as a sweetener, and they noticed that dental decay dropped tremendously in a couple of years.
So this was accidentally, they found out about it.
Exactly, it's like a side effect.
Okay. All right, so now we know what? We know that about 7 to 10 grams a day of xylitol in some form will help prevent decay.
Exactly. You want to use it incrementally throughout the day, 7 to 10 grams a day. We say strive for 5 times a day exposures.
Okay. 5 times a day, so you're looking at about 1.5 to 2 grams 5 times a day. And in what forms do we have that we can take that?
Well, the products are designed so that when you use them 5 times a day, you're getting a little over a gram, so you're going to get the 7 to 10 grams. You don't have to count it out.
Right.
So if you're just utilizing gum, you can do that 5 times a day. You can mix that with mints. Or if you can take your Xylitol Sweet here, put it in your tea, and that can be another exposure. You kind of want to tailor it to your daily life, not make it complicated. If you just replace what you're already using for your oral health with our products and add a little gum and mints, then there you go. You've got the 5 exposures.
What percentage of decay do we decrease if we do our 7 to 10 grams a day?
If you use it habitually on a continual basis, it has been shown, studies show that it decreases decay by 70%. And it also has a latent effect after you've stopped using the xylitol for up to 3 years that we know of.
Wow, that's fantastic for our patients. So we've got gum, we've got the sweetener in the tea, we've got, what else?
We have baby products. We have it for all ages.
That's
the
phenomenal.
Baby products are wonderful. We actually have this little pacifier that opens up. It's a medicinal delivery system. You put the baby tooth gel in this, and it has a little valve here, and as the baby sucks on this, after each feeding, it exposes the strep mutans to the xylitol and the eustachian tubes in the back of the throat. And what that does is it actually keeps that little baby from getting ear infections.
Wow, that's phenomenal what we can do there.
Isn't that great?
Yeah,
and so it allows their mouth, their oral health to be in a really good quality for when those teeth do erupt. And then if the baby uses the xylitol for the first 2 years of their life, it actually helps their teeth for the next 3 years. They've done studies. It's amazing.
Wonderful. And in our adults, we've got the gum, the sweetener, the mints.
And also dry mouth. Okay. First of all, xylitol does 4 things to help with the oral cavity. It reduces strep mutans. It raises the pH to neutral level.
That's huge.
It is huge.
Yeah. That's the key.
And it's hydroscopic, which means it brings water to the area.
Okay.
Anyways, because it has a cooling effect, and it also remineralizes the teeth. It acts as a vehicle in some manner, which I'm not exactly sure, but it takes those calcium ions at a very small microns to the base of the issue of the teeth. It helps remineralize those teeth. So with dry mouth, it's amazing. And all of our products have calcium ions associated with it, as well as a high percentage of 100% xylitol, sweetened with xylitol.
How do we get in touch with you?
Well, I have my card. There's 6
Is there a website?
There is a website, or you could call customer service, and there's 6 xylitol educators in the country, and we have our particular regions, and we can come to your office and do a free CE, or we can speak to your study club or component meetings or whatever you would need, and we can come and help you to integrate a xylitol protocol into your practice.
Okay, and what's your website?
Our website is www.clear.com.
Lisa, thank you so much.
Oh, thank you so much, too. It was really fun.